A new statewide study by researchers at UCSF is shedding more light on the homelessness crisis here in California. It's the largest study done on this issue in nearly 3 decades. The report found more than 171,000 people experiencing homelessness in California. That's 30% of the country's homeless population. And researchers found that most of those people were living in California before they lost their housing. The study also found California's homeless population is aging, with nearly half of participants over the age of 50. And it also found a disproportionate number of people experiencing homelessness in our state are Black and Indigenous. For more on these findings, we're joined now by Dr. Margot Kuchel, the director of UCSF's Benioff Homelessness and Housing Initiative, which conducted this study. It's great to have you on today. We appreciate you taking the time. Why, first off, why does California have such a disproportionate homeless population when you compare it to other states?
Yeah, I think the answer is just in the cost of our housing. When we look at areas of the country with more homelessness or less homelessness, it goes simply with the cost of housing. We have extraordinarily expensive housing. We only have 24 units of housing for every 100 extremely low-income households. That means people who make less than 30% of the area median income. These are not folks coming into California once they're homeless. These are our neighbors, our friends, our community members.
And your study gives us really a snapshot of who people are who are experiencing homelessness here in California. I want to put a graphic on the screen here because you found, as we talked about, the homeless population in the state is getting older. 47% of adults are 50 or older. And then you look at these numbers here. 26% of the homeless population in California is Black, compared to 7% of the statewide population. And 12% of homeless people are Native American or Alaska Native, compared to just 3% when you look at the statewide population for those groups. And so talk about why it is important to understand who is living on the streets in order to make sure you understand how to best help them.
You know, we have a lot of mythology around homelessness that's just not going to get us out of this crisis. This is an aging population. These are folks who, even though they're mostly in their 50s and 60s, although our oldest participant was 89 and experiencing homelessness, they look more like people in their 70s and 80s. Lots and lots of significant health problems. We need to attend to those. If we continue to have this myth that people are moving into the state, we're never going to get out of it. These are folks who are really poor. The median income before they became homeless was $960 a month. They simply got priced out of living here. And I think the disproportionate representation of Black, Indigenous, and increasingly Latinx folks speaks to all the ways that structural racism interact and lead to this crisis.
And with that in mind about where folks were living before they found themselves on the streets, I want to put up one of the other findings here of your study. 90% of participants you interviewed told you that they lost their housing here in California, and 66% of them were born here in this state. I want to get your sense about why that figure stands out to you here, and what does it suggest in terms of what people need in terms of rental subsidies to be able to get back into a permanent housing situation.
Yeah, I wasn't born in California, but I've been living here for almost 30 years. 66% born in California is more than most Californians, right? That's a higher percentage. People really need the ability to pay their rent. When we ask people what would have kept them from being homeless, actually relatively small amounts of money. Over 8 in 10 said had they received one time $5,000 to $10,000 to catch up on their rent, to pay first and last month's mortgage so that they could continue paying, a new apartment, they would have never become homeless. We need to actually have real conversations about the real problems facing us, and that's how we're going to get to the solutions.
Okay, your study here finally also highlighted the real struggles that obviously we see people living on the streets are facing here in California. 2/3 of the people you talked with reported mental health issues, symptoms of depression, anxiety, hallucinations, and almost a third reported using illicit drugs. What are the other policy recommendations that you think stem from this study that you put forth here in terms of solutions that can get those folks the treatment they need and hopefully eventually into permanent housing?
Yeah, we know that about a third of folks were regularly using substances. Methamphetamines was the most common one. About two-thirds, as you said, had mental health problems, although it was about half were depression and anxiety. We know that folks with mental health problems, we know that folks with substance use problems can be housed successfully. We know that requiring treatment first is a failed policy. Actually, 6% of people, of everybody, had been in drug treatment at some point during their homelessness stay and then had left and come back to homelessness. What we know is we need housing with the appropriate supports. These folks are going to need mental health care. They're going to need substance use care. They're going to need the treatment that any of us would want for our friends and family. But for those things to stick, it needs to start with housing.
All right, a really important snapshot here of the homelessness crisis in our state and some of the solutions put forth here with this data. We really appreciate the time today. Dr. Margot Kuchel from UCSF, really good to see you. Thank you.
Great. Thank you so much for having me.
Sure.